please click on the participants button and then click on the raise your hand button. That way it'll notify us that you have something to say, and the city clerk can unmute you when the time is appropriate to address the group. So with that, I'll go ahead and hand it off.
Okay. So happy Earth Day, everybody. I just want to read something for you about the history of Earth Day, which today is the 50th anniversary, and I remember it well, actually, the first one. I was a sophomore in high school, and Jefferson High School in Daly City, and it was celebrated extraordinarily with all the students. So Earth Day, of course, it originated from Wisconsin Senator Gaylord Nelson, who sought to increase ecological awareness, and according to history.com, forced this issue permanently onto a national political agenda. His efforts paid off. Millions of people participated in the first Earth Day, and it is now celebrated every year on April 22nd. 50 years later, the festivities are global, with 1 billion participants in more than 190 countries. This according to earthday.org, and this source of this article was history.com. Thank you, everybody, and celebrate it in this extraordinary times. So you see on the thing right there, our staff has put up some things that you can do for this month-long celebration that you can do while you're at home. Okay.
Thank you.
To Louise, right?
Thank you. Shall I go ahead and start?
Yes.
Okay. Hi, everyone. I'm Louise Rogers. I'm Chief of San Mateo County Health, and I'm here to give you an update on the status of the COVID-19 in the county. And also I'm looking forward to trying to answer your questions as well. First of all, I really want to thank you on the council and also your residents for the ways that you have endured the orders to shelter in place so that we can all collectively prevent the surge of demands on our hospitals and prevent the spread of the virus. And judging from the information that we have in the county about social mobility indicators, we have massively collectively reduced activity, specifically related to retail, recreation, and transit. It's down by like 83% for transit, 60% for recreation. And so there's really no doubt that working together, we have all really prevented the spread of the virus. And our health and hospital systems remain okay and able to serve everybody who needs their services. So that is really important, and it's a great credit to all of you, all of us working together. So I wanted to start by saying a little bit more about the shelter-in-place orders for people who may not be very familiar with them. So on March 16th, the first orders were issued by the health officer, the county health officer, who is Scott Morrow, and I see his picture is up there with the big beard. And those orders were extended on March 31st until midnight on May 3rd. And essentially what those orders do is they direct everyone who lives in the county to shelter in place at their residence, except for when they are addressing essential needs. And the orders themselves go into some detail about those essential needs. And of course, that does include obtaining medical care and groceries. It also includes things like exercise. But basically, there are many, many limits placed on us that are designed to increase social distance between people unless they are members of the same household. And by increasing that social distance to 6 feet and doing everything we can, including frequent hand washing, to prevent the spread of the virus, we really enable the healthcare system to be able to continue to meet everyone's needs. The health officer's orders are posted on the county website, on my website at sanmatocountyhealth.org. coronavirus. If you want to search for that on on the internet, you can find all of his orders there, including this one. And this order also goes into a lot of detail about what are essential activities, what is essential travel, what are essential businesses, and how we can all prevent the spread of the virus by essentially limiting our contact with each other. Those orders also limit public and private gatherings of people outside a single household or a living unit. And so large gatherings are absolutely prohibited, but even small gatherings among friends are prohibited at this time, with some exceptions that are noted in the orders. The other thing I wanted to mention is that very recently, just the other day, a new order was issued, and that was on April 17th. And this does not, it will not be enforced until April 22nd. But this order is that we all have to wear face coverings. And these are distinguished from masks. Masks often refer to the masks that medical professionals wear, surgical masks and 95 masks. This is not an order about masks. It's an order about face coverings, essentially bandanas, cloth face coverings without holes that cover your nose and your mouth. And essentially these are aimed at preventing the spread of the virus, because we now know that people can be asymptomatic and not even know they have the virus. And by sneezing or coughing, their germs can spread, and it can become contagious, and it can be spread even when someone doesn't know they have it. So the face covering is one way to prevent that. And they are required now by this new health officer order. Anytime someone is outside their home in the following situations, when they are either in line to get into an essential business, for example, a grocery store, or when they are inside that business, a grocery store, a pharmacy, a laundromat, or when they are inside any location or facility doing work that may be essential. If they're in the hallway of their office, if they're in a crowded area of their office, then those would be circumstances when social distancing would be needed of at least 6 feet, and also wearing a face covering. So there's a lot more information as well about this order that you can find again on our county health website at smchealth.org, coronavirus. So in addition to talking about that, I wanted to give you guys a little bit more updated information about what's going on with the spread of the virus in our county. Right now, we have 958 known cases. We recognize that the level of spread is much greater than those numbers would suggest, because people haven't had access to testing, and testing criteria has been very narrow, primarily aimed at people who are symptomatic, who have been in known contact with someone who is positive for the virus, first responders, and healthcare workers. So we know the virus is more widespread than those 958 cases indicate. I also want to note that of our 958 cases, 118 of them are associated with skilled nursing facilities or assisted livings, other congregate care types of settings. And that's not surprising, because people do live in close proximity in those homes. And in addition, many people who live in those homes are older adults and medically fragile and more vulnerable. So the county has been very focused in the last weeks on supporting those facilities to be able to meet the needs of their residents. We've sent in medical staff. We've assessed those facilities when they appeared to have more than one case. We've worked closely with the state and federal government to try to help those organizations assure the safety of their residents. Testing does remain constrained, but the California Department of Public Health recently updated their guidance about testing and loosened it a bit. And I think that suggests that in the coming weeks, we'll see that more testing will be accessible in our region. And that will be helpful to those of us in public health to be able to know more about how extensive the spread of the virus is in the community. I also want to note that we have had 39 deaths in the county, and we have begun posting the ethnicity and race data associated with those deaths on our county health website. 62% of them were white, 26% Asian, and then the remaining numbers of Hispanic, Black, and unknown were very low, below 1%. And all but 2 of those people were over the age of 60, and slightly more than half were male. Another focus that we've taken, as I mentioned, is really keeping close tabs on our hospital capacity and making sure that the hospitals are not overwhelmed. We look at that on a daily basis. The hospitals are surveyed on a daily basis, and that helps us figure out if they have enough capacity. And if we all of a sudden had large numbers of cases, if the hospitals could expand their capacity to be able to meet all of those needs. And so today in San Mateo County, we had 72 people in the hospital as a result of the virus. 22 of those people were in intensive care units, and we had plenty of capacity in the hospitals, including in all of the different types of units, as well as plenty of ventilator capacity. And I know that's been a big focus of the public, is the issue around ventilators, but we appear to be well supplied right now in San Mateo County. I should also note that we've had 168 people successfully discharged from hospitals after having been hospitalized for the COVID-19. And most of those people are going home. 67% of them went home, and the rest of them were returned to their congregate living environments. I also want to note that we're trying to keep our website up to date with information that you may be interested in, also resources. We will be publishing in the next week. At the end of next week, we'll start publishing the information about the positive cases by zip code, which people have been interested in seeing, along with estimates of prevalence in those zip codes. And then lastly, I want to note that the community has really stepped up to help people in need. And one of the issues that's come up quite a lot is about food insecurity and people who don't have access to food, particularly seniors. And so you may already know this, but I wanted to mention in particular that the Daly City Partnership has been available to make arrangements for meals to be delivered to people who are over the age of 60. And I have contact information for that if it would be helpful if you don't already have that. So that's it for my formal presentation, but I would be happy to answer any questions that you have.
City Clerk, is there any hands raised for Louise?
Well, I was hoping we're waiting for questions coming from any of our audience.
Well, yeah, so the function to ask a question is to hit the button that says raise a hand. So that way we know.
If there aren't, there's a couple of more things I just realized I would like to add. I can always.
There's one question also from the Zoom group chat, if you could see that.
Oh, let's see.
The thing that I wanted to add is you all are probably all wondering about what comes next. And what will come next fairly soon are revised health officer orders. Our health officer and I work really closely with the other Bay Area counties to try to, well, first of all, to share information, of course, about how it's all going, but also to try to develop the next phase of orders that makes the most sense given what we're seeing in the community and given the risks, but also the tremendous challenges that everyone faces and the hardships that people face. And so those orders are being developed now, and I would expect that in the near future, certainly by the time the current orders expire, there will be new orders. And so we're all working together on that.
Louise, if I could just, it's really interesting that the 6 Bay Area counties got together, and I consider was extraordinary how they got out in front of that, and it's kind of really what I'd term as a leader in the United States at the rest of the United States had followed this methodology, I think the impact would probably be a lot less. Can you kind of tell a little bit of history about how that came about, how this came together?
Yeah. Well, I think there's wide recognition in the Bay Area that we're all kind of part of the same ecosystem, and that if we don't adopt similar approaches, and of course there are differences and there are local needs that have to be addressed, and some very different environments, of course, like very urban areas and less urban areas. But I think there's wide recognition that if we're not substantially on the same page, it can be very confusing and difficult for all of our residents to know, to really be able to keep track of it all. There's so many people, for example, that commute and that have family members that live in neighboring communities. The history is that it's actually been very difficult, to really get on the same page over the years. I mean, I've been in health in the Bay Area for 30 years. And I cannot think of many times when we have actually been able to get on the same page about many things. There are very strong relationships, and there's a lot of collaboration that goes on among the counties. And we have routine meetings and phone calls in the Bay Area, and the health officers do, as well as the directors of health. And we share learnings. But I can think of very few times in the past 30 years that we've actually gotten completely on the same page. And I think that the fact that we did this time was a testament to the clarity about the risk. The clarity about the risk to the residents of this community, and the urgency of acting quickly. And I think in remaining phases of all of this, it will be more difficult because we did such a good job, I think, of nailing it in this first phase. And also I want to give a lot of credit to the hospitals all around the region who basically cleared the decks to make room for people, knowing that they had to meet so many diverse needs all at once. But they canceled all of the elective procedures and all of that, and it was very difficult. So I think it was the urgency and the pre-existing relationships that really helped us take these steps together.
We have one question from the group chat. This person would be interested in the information for volunteering to assist with the food insecure.
Oh, okay. Well, so the contact for the meal delivery at the Daly City Partnership is Maria, and her last name starts with an O, Maria Orleman. And her email is mariao@dcpartnership.org. And her phone number is 650-991-8007. And she would be the best person to talk to about how to volunteer, and also how to make arrangements for meals if you are a person over the age of 60 who needs assistance with that.
I know that in the city of Brisbane on Wednesdays, we're coordinating some lunch deliveries also for seniors.
Oh, that's great.
And, the city of Brisbane has more information if there is if you're a senior who would like a lunch, or a senior that would benefit from a lunch delivered contactless, then we can assist with that. I see another question here in the chat. Of the 958 known cases, how many required hospitalization?
That number is, it's the 168 people who were discharged, plus the folks who are in the hospital right now. So that's 72. So 240 of the 958 have required hospitalization. And that is, I'm a person who likes percentages. So that is 25%.
Yeah.
What about the people who died?
Well, you're right to think of that. They mostly were in the hospital, not all of them. So it would raise that percentage slightly.
Okay.
And I think the main thing that we know from other countries where their testing was far more extensive is that it appears that about 20% of people who are positive end up needing some kind of medical intervention and potentially even hospitalization. That 20% appears to be on track for the US. But because our testing has been so much more limited than in other places, we don't have a full sense of the number of people who've actually had the virus in the first place. And it's also the case in San Mateo County that most of the people who are hospitalized and nearly all the people who died are older adults and people with medical complications.
They've been saying during our county calls that San Mateo County has the highest rate of aging population of any other county in California. So we have a higher, percentage of older people here. So it makes sense that statistics or that percentage of hospitalizations is going to be a little bit more.
Yeah, well, that's absolutely true. And that's one reason that we're so concerned about everyone in assisted living and skilled nursing facilities. We have about 6,000 San Mateo County residents in assisted livings, and we have about 1,600 in nursing homes. So that population by itself is definitely at high risk.
Right. Okay, I think, are there any other questions for Louise? Okay.
I really appreciate your time. And again, I really want to just thank you. I wish I could see all of you in person, shake your hands, but those of us in health and all of those frontline health workers are just so grateful for everything that residents of this county are doing to help keep everybody safe and out of the hospital. So thank you.
We appreciate you taking the time to come on here. I know there's a lot of information that you talked about that people want to know. So appreciate it.
Stay healthy, everybody. Take care.
Louise.
So I think that brings us, is Beth our next presenter?
Yeah, I'm right here.
Okay.
Can you hear me?
Welcome, Beth. Thanks.
Hi, thank you. First of all, thank you for having me. I really appreciate it, and I'm excited to tell you a little bit about Samaritan House. Samaritan House is a nonprofit in San Mateo County. We've been around for about 45 years. What we do is we serve basically the working poor in San Mateo County is our demographic of client. We provide safety services to help them out of homeless situations and definitely to keep them out of homeless situations. We see clients that come in crisis situations. We immediately help them with either rental assistance or food or whatever they need. But we don't stop there. We bring them back. We really get to know them, and we work with them to see exactly how they got into that situation. And we work with them as a team to figure out how to get them out of the situation and to keep them out of poverty. So we do provide rental assistance, food pantry. We do have an emergency shelter. And one thing that we have that is really helping out, especially at these times, we have 2 free clinics. There's medical and dental, completely free for the uninsured to come. And it's also taking a big workload off of the hospitals because we're able to triage and keep them out of the emergency rooms and keep them in our clinics. And we're able to actually do a lot of our appointments on teleclinics right now. So that's basically in a nutshell what Samaritan House does. Last year, we saw almost 14,000 clients. I cannot even imagine what our numbers are going to look like right now. Just to give you an idea what we're looking at, in the beginning of March, we were getting about 20 applications a week for rental assistance. We are now up to over 20 applications a day for rental assistance. On average, we're having about 250 families coming through our food pantry to get food these past few weeks. And we only anticipate it's going to continue to grow. So we're always looking for donations. We have a main event. It's our gala that was scheduled for March 28th that we did have to pivot and turn into a virtual event. It's going to take place next Thursday evening. So we do encourage people to log on. It's a free event. Come check out the program, live auction, silent auction. all different ways to get involved. We do need volunteers. We still have our food pantry open. We've turned it into a mobile food pantry. We also do delivery of meals to people's homes. People are homebound, so we're always looking for drivers to help deliver those meals. So there's several ways to get involved. Our website tells you exactly what our needs are. And so if you have any questions, reach out to me. My information's on the slide. And we would love to have support, and we appreciate everything that the community has been doing. We've seen a huge amount of support lately, and we truly appreciate it.
Thank you, Beth. Does anyone from the audience have a question for Beth? Oh, I didn't realize you were still going. Did you want to go over this last slide? Sorry, I thought you were done.
Oh, I am. I can't even see the slides.
Oh, okay. I can read. Oh, here the slides are kind of catching up, I think. There's an ad for your Samaritan House main event. I'll just read it here. We're excited to announce that Samaritan's House's main event is going virtual. While social distancing and quarantining are challenging us all, we believe that social connection is more important than ever. Please join us for our first ever virtual main event. The main event raises critical funds to provide food, shelter, clothing, and healthcare to the working poor in San Mateo County. Now more than ever, we must come together. The main event is Samaritan House's signature fundraising event, and we are determined to celebrate all of that work that Samaritan House does, not only in these uncertain times, but year-round for thousands of our neighbors in need. And then there's the link there if you want to register. And then I'm assuming if anyone has questions, they can also email you as well.
Yeah, of course.
So is there anyone from the audience with a question? You can use the raise your hand feature, or you can type a question for Beth in the chat. I'll just give a second. See if there's any questions. All right. It doesn't look like any questions are coming through, but we really appreciate your presentation. And so would you say, in terms of volunteering, your biggest needs right now are people to drive and people to, would it be packaged food for people who are coming to pick up, or how would the different roles work?
Yeah, what we've turned our food pantry in is we've turned it into like a drive-through in our parking lot. So all of it's boxed food, boxed meals, and then people just drive through, no contact, and we put the meal in their car. So it's just like a little assembly line. So we just need people to be outside handing over the boxes.
Perfect.
Mm-hmm.
Doesn't sound too hard. That sounds
Yeah.
like something everyone can do.
Yeah.
All right. Well, thanks so much, Beth.
Thank you. We really appreciate the time.
Yes, absolutely. Thank you for all you're doing, and keep up the good fight. I know that you guys are probably pulling some really long hours right now.
We are. We're definitely keeping busy, but we will get through it.
Yes, we will. All right. So I think that brings us to the next portion of
You, Beth.
Oh.
Thank you, Beth. Yeah.
All right. So I think that brings us to the next portion, which I guess is my portion. We're going to be talking about San Mateo County Strong. And just to give a little bit of feedback about what this is business related. So San Mateo County Strong developed a fund seeded by $3 million worth of Measure K funds, and that's been divided. So $1 million has gone to nonprofits that are our core agencies, like people like Samaritan House, Second Harvest Food Bank. And then from there, those organizations are distributing another $1 million to families in need. The last remaining $1 million is for small businesses. And the San Mateo County Board of Supervisors is partnering with the San Mateo Credit Union in order to distribute those $1 million. Distributions will be made based on population. So Brisbane will likely get a handful of grants. The grants are up to $10,000 each. They don't need to be repaid. So the money is free and clear. And eligibility requirements are as follows. So you need to have between you need to have 2 employees or more, up to 10 full-time equivalent employees, or you can have 2.5 million in annual gross revenue over the past year. You also need to have a valid business license if required by jurisdiction. So if you have a business that's in an unincorporated area of the county, then you just need to provide something like a seller's permit. You have to have been open for at least 1 year, and you need to have an office, a storefront, or a business space that's open to the public in San Mateo County. And you must demonstrate a 25% reduction in gross revenue due to COVID-19. So the applications will open up on Monday, April 27th at 12 p.m. And because funds are so limited, it's imperative that if you want to apply for a grant, you should do so immediately at noon. Applications can be made online, so you don't need to go into a branch. You should have already prepared your bank statements, current profit and loss statements, IRS or federal tax returns, and then proof of rent or mortgage payments, utility, healthcare premiums, payroll processing, just anything that you need to really validate your business and your finances. And then San Mateo Credit Union will evaluate those applications, and then they will forward the eligible applications to the county, who will review those. And the grants will be made in order of receipt. And you do not need to have a relationship with San Mateo Credit Union in order to be eligible. There is no application fee. You do not need to be a citizen of the United States to receive a grant. So those are kind of just the baseline requirements for San Mateo County Strong. And SAMCETA, as well as other organizations in the county, are working really hard to raise more money. So we're hoping that initial $1 million is just that, an initial amount of money. If you do not receive a grant, you will still stay in that queue. In the event that we receive more funds, those businesses who didn't receive anything initially are still eligible in case anything comes in. Other things to be aware about, and I'm happy to take questions about this later. I won't go too into detail, but there are a couple other grant programs that are available. Facebook has a grant program available right now, and that's for $2,500 cash and another $1,500 in optional ad credits. Qualifications are sort of similar to this SMC Strong Fund, although you can have up to 50 employees. And then Salesforce also has a grant program that's going to be opening also on Monday, April 27th. That's going to open at 8 a.m. And that's also for a $10,000 grant. And they have 300 grants available. So one thing that I know is going to be true about these programs, same with PPP and the SBA loans, is that time is of the essence. So if you want to apply for one of these, I highly encourage you to prepare in advance, get all your documents together. If you don't have a scanner, I know that SMC Strong, the San Mateo Credit Union will accept documents that are, you just take a photo and upload it to your computer. So it doesn't even have to be a fancy scan or anything. So if anybody has any questions about those specific items, I'm happy to answer that as well. But that's an update on SMC Strong. And then I believe we have another update from the city.
Okay, thank you, Madison and Clarke. So just a couple of items to update on. The US 101 deck replacement project at Alamany Circle is actually going to be starting on this Friday. That will impact access going north from Brisbane into San Francisco, especially if you're going to the west side of town or to Daly City. This project was originally going to be done in July, but they are taking advantage of the fact that there is reduced traffic now. It should be done hopefully within the next couple weeks or by sometime in early May. And if you want more information, you can get it at 101alamanyproject.com. This is a state of California Caltrans project. The second item is we've gotten a lot of requests from our sister cities on the coast, Pacifica and Half Moon Bay, regarding people coming over to the beach to on the weekends and to recreate, to walk, to just get outdoors. While that's totally understandable, the health officer's order is really for people to stay within 5 miles of their residence. The beach towns have gotten overwhelmed in the last few weeks with people coming over there, and there will be enforcement of the 5 mile this weekend. So we ask just cooperation that we try to give those communities a break in terms of the number of people coming over. So that's Half Moon Bay, Pescadero, and Pacifica beaches. And Madison referred to this earlier, but I'll just make another mention of it. Today we did, in partnership with the Samaritan House, Parks and Recreation Department of the City of Brisbane, and the Lions Club, did get out 36 meals delivered to seniors. And we're going to be starting to do this on a weekly basis on Wednesdays, and trying to get to our most vulnerable community members of our community. And this is, I think, a really good program, and another reason to really support the Samaritan House and their efforts. They are very much an active player in our community. And I think that's all I have tonight, other than I just want to also kind of thank Beth and Louise for being available tonight. It was on a very short notice that they responded, and really appreciate their participating in this forum with us.
So
And we also have one chat question.
cool. Is that the one that's for me?
It's regarding the sample application form.
Okay, so I'll just go ahead and open it up to Q&A. So now will be the time we'll just transition into Q&A. Again, if you have a question, use the raise your hand option or type the question in the chat, and then the clerk can unmute you if you'd like to have a back and forth discussion. So also be mindful that we are recording this and live streaming it. So don't say anything you wouldn't want your grandma to hear you say. And I don't think that's a problem with this group, but just in case. So the question from the chat here is there a sample application form available for the San Mateo Credit Union and Salesforce grant? No, not that I know of. I've been researching this a lot, and Salesforce, the website is not, it's pretty, there's much to be desired. I'm just going to say that in terms of the information that's available on their website. They're actually using a platform called Eureka, and don't know a whole lot about Eureka, but I think kind of what Eureka's purpose is to evaluate the eligibility of all of the applications, and then select. Eureka will be the organization that's going to be selecting who's going to be receiving the funds. And so Facebook and Salesforce's applications are hosted on Eureka's site. So there's not a whole lot there. And then San Mateo County Strong is moving really quickly. And I don't anticipate that there's going to be any sort of sample that's going to be available prior to when the application date will be. But I do highly encourage, if you have questions, you can always go on the SMC Strong website. I don't know if we have it posted on one of the slides, a few slides back, but the FAQs are very, very detailed. And if you do have a question, you can also likely call, I think maybe 211, but you could also reach out to SamCETA, or if you have other specific questions, you can also reach out to me directly. So website smcstrong.org. That's what I thought it was, but I wanted to make sure.
Yeah, Madison, not everybody knows what Samsita is, so could,
San Mateo County Office of Economic Development
Association.
Association, something. Mitch
Yeah.
is here. He can get it. He can get it perfect. I know he knows.
Mhm.
So Samsita for short, because that's a mouthful. Oh, Mitch knows, but he's muted. Anyway, Samsita is really leads the county in terms of doing economic development. They've been a fantastic resource for a lot of the local chambers, as well as for many of our local governments. They are really spearheading this process. They are going out, they're fundraising, and they're also posting just a wealth of information on their website. I would say they have the most comprehensive resource for small businesses I've seen in this process so far. They're constantly putting up different opportunities for people to seek funding, keeping people up to date on where certain programs and grants are at, and even just giving general business tips that I think are really good. In the event you can't get a grant, what are some of the things that you might be able to do to pivot your business right now in order to meet the challenges that you're facing? So I highly recommend checking out their website if that's something that you're interested in learning more about. Okay. Do we have any other questions? I don't think so.
I don't see hands up.
We have a quiet group this week.
Because it's Earth Day.
That's it.
Everybody's out planning, working in your garden.
That's right. Okay. Well, I think that's it. I just want to thank everyone for joining us this evening. The next virtual City Council Town Hall is scheduled for next Wednesday, April 29th at 7:30 p.m., where you are going to be your weekly entertainment every Wednesday until we are out of this thing or until there's no interest. So please sign up for the weekly blast to get the latest news, www.brisbaneca.org. We also on Sundays will send out a letter from a council member. So that's your way to get updates directly from us, as well as important updates from the city. So we hope you all will sign up. Be well and stay safe. Thank you all.
Stay safe, stay happy. All right. Good
All right.
night.